Welcome to this training video about e-ELCA, End of Life Care for All, e-learning from e-learning for healthcare. I'm Christina Fall, I'm the National e-ELCA lead, and I'd just like to take you through looking at some of the availability of sessions on e-ELCA. So here's the web page for e-ELCA, and on a different session we'll cover things about registration and login, but assuming that you have a login already, from the web page we can go to login. I've already entered my login details and I've come to my e-learning. You can see I'm signed up for lots of different sessions here. I'm going to go to the e-ELCA, e-learning for health, on end of life care. Down in this column is all the different e-learning that I have, and here are the modules and sections of the e-ELCA program. In this one I'm going to be particularly showing you the collection of sessions we've put together of e-ELCA to do with learning towards supporting you, developing skills and knowledge with the priorities for care of the dying person. That follows the One Chance to Get It Right report, and the objectives to develop a skilled workforce to make sure that end-of-life care for everybody, no matter whether they're in hospital, at home, in care homes or in hospices, is provided by skilled people. So within this particular section there is quite a variety of resources here. The first one here is a training needs analysis. That allows you to work out the sort of learning that's most helpful for you based on what you feel confident in, what you feel less confident in, mapping to what's thought to be really important. So here you'll see those priorities for care of the dying person, the recognizing when people are dying, communicating with them and their relatives about the position that you think they are in and what's happening to them, involving them in decision making, particularly decision making about ceilings of care, so what sort of treatments they do and don't want and where they would like to be, supporting them, making a plan which includes plan for food and drink, symptom control, psychological, social and spiritual support, making sure that's coordinated and delivered with compassion. And it's a circular thing, continue to support, communicate and recognize. So those are the 5 priorities. This is some general information about e-ELCA, and this is the training needs analysis. So we've given you questions, 16 questions, against which to map whether you feel that you strongly agree or strongly disagree about your level of confidence usually. So for example, I feel confident that I can act upon holistic needs and choice of the person who's dying. If you don't feel confident, then we're directing you to sessions within section 1, which are here, mostly about assessment for that holistic needs assessment. If you feel if you don't feel competent to identify that the dying phase is imminent, look in section 9. So you can tell there's quite a few sections which identify particular e-ELCA sessions that fit with those aspects of care. I'm just scrolling down here to section 9 so you can see what sessions are including about recognizing that someone is dying. So this is session number 0214, assessment of dying and after death, breaking bad news, request for organ and tissue donation, request for euthanasia. Two key sessions in priority care are this 214 and also 423. I tend to think that the 423 one is perhaps more useful for doctors, and the 214 perhaps more useful for other clinical staff. And from these hyperlinked parts of the training needs analysis, you can link straight on to the session. So I'm taking you now to the session information page for session 214, assessment of the dying phase and after death care. It tells us a little bit about the session, who authored it, and if we want to share that, you can just copy that URL and send it off to our colleagues. If we're educators, that's quite useful to send that to a group of students to do perhaps before a session that we're going to discuss things in. If we want to go straight into session, we just press play. You can see I've done this before. I can carry on where I've left off, or I can go back to the beginning. So this session focuses on the critical aspects of holistic assessment of the dying patient, including their family and carers. So if we go back to my e-learning, this takes me to a slightly different looking page. So we're going to navigate into e-ELCA in a slightly different way, and I'm now coming back to those modules or collections of different sessions, going to this one for the priorities for care. And within this collection of sessions, so we've looked at the training needs analysis section. Going back now to other parts, you'll see that there's something called learning paths. And there are learning paths for doctors, nurses, allied health professionals, and so forth. So if we looked at, for instance, the learning path for social workers, that tells us that there are core and there are additional, and that's so for all these sessions. And if we looked at the core sessions, those are the collection of sessions there that we feel any social worker or social carer rather would feel most useful in caring for people in those last days of life. And I'll leave that session at this point.